Expecting a larger audience today. I'm hopeful people are able to log on. We'll give them just a few more minutes. Welcome to everybody's with us. For those who have joined us, if you'd like to put your name and where you're calling from in the chat, please share. Yay, friends from Texas and Colorado and Florida. Oh my. Welcome, Tennessee and Wisconsin and Washington, D.C. Give it just a few more minutes. Our friends in North Carolina. You know how it goes. You put this on your agenda and then 14 other things happen. And I wanted to be in that webinar. So hopefully people will join us or they can see it once we post it. I have a great webinar for you today. And I think we'll go ahead and get started. I want to make sure we have time for all of this material and the Q&A. Welcome, everyone. We have a conversation today that's long in the making. Childcare and workforce, and that constant battle for working families. Who's going to take care of the kids? Where are we going to find quality and affordable care? And can we keep a job if we can't find quality and affordable care? It's a huge problem for most families. It is one of the largest expenses for most families. And our speakers today are well equipped to tell you a little more about this conversation. You see the agenda before you. We'll get moving on this. Well, slides are not moving. There we go. Today, we have some wonderful people who have been involved with childcare and many with NAWB for a long time, beginning with Madeline Levin. Sorry, Madeline, I got it wrong. Oh, mission-driven public health professional with over 20 years of experience in maternal and child health policy, federal nutrition as well. She previously worked in child and human development, leading a project at Georgetown University, and is a senior analyst at the National Center for Health Research. Madeline joins us today in her capacity as a principal and associate division director with Social Policy Research Associates, an agency most of us are very familiar with and rely on for good information. She will present the report on a recent work with NAWB and the Family-Centered Employment supported by the Annie E. Casey Foundation, explaining the report and their findings. In addition, we have Tracey Carey. Tracey is a longtime friend of the system and a workforce professional of many years, serving as Director of Fund Development and Strategic Initiatives at Employ Milwaukee and Chief Strategy Officer at Partners for Work in Pittsburgh. Today, she joins us from her current office as CEO of Midwest Urban Strategies in Milwaukee with a very exciting project partnering with Early Child Workforce Connector. She'll explain to us what that is and how apprenticeship is affecting childcare and the care industry. And kicking off our conversation today, as a good friend of mine, and I know many of you on the call, Reagan Miller, Director of Childcare and Early Learning for the Texas Workforce Commission, where she manages a fantastic team, operating childcare assistance from the same agency that manages workforce, emphasizing quality childcare and the childcare workforce needed to keep workers working today. Prior to the dozen years she has devoted in this role, Reagan Miller was the workforce director for the state agency. And she knows as much about our system as we do as workforce professionals. Seriously, she is an amazing professional in both arenas and currently sits as the chair of the Texas Early Learning Council. I will let Reagan take it from here and hope you all enjoy this fascinating conversation. Reagan?
Thank you, Lori. Happy to join all of you today. I did serve as workforce director for years, but most recently, we carved out childcare into its own division here at TWC. Each state gets to decide who the lead agency is going to be in the administration of the Child Care and Development Fund. And Lori, if you can go to the next slide, that's the fund that's the primary funding source for subsidized child care all across the nation. And Texas is one of 4 states that has designated their workforce agency as the lead agency for this child care block grant. Utah, Arizona, and Ohio also have their workforce agency as the lead CCDF agency. But Texas is still a little more unique than those other 3 states because we actually run this program through our local workforce development boards. These other workforce agencies that operate childcare don't actually run the program through their boards. They're more of a state-operated system. But we have utilized the workforce board infrastructure to help us administer childcare services in our 28 regions. You'll see that you have the red box going into the blue box, which is TWC, but we have a partner agency, the Health and Human Services Commission, that does childcare regulation for all childcare providers in Texas. So that's another critical aspect of the services that we provide through this block grant, is making sure that health and safety is taken care of in all of our childcare programs. But the bulk of the money is administered down through our 28 local workforce development boards. Those boards, using their childcare contractors, oversee childcare subsidies and a program that we call Texas Rising Star. And that's a quality rating system that's used to look at how higher quality care above the standards that are implemented at childcare regulation. And then, of course, we have a lot of other partners that we work with all across the state. The Child Care Development Block Grant has really grown exponentially over the past probably decade, 7 years or so. Texas used to receive, and we do receive the largest amount of any state. We used to receive about $500 million a year to administer. That was around 2017. We now receive over 1.2 billion in funding to administer. So the federal investment in the child care block grant really has grown significantly. In fact, the first Trump administration really invested heavily in this block grant, more than doubling it during that first administration. And we've continued to see growth with the last administration, the Biden administration. I think we've been really fortunate. There's been a lot of bipartisan support for investing in childcare. Okay, next slide. Lori,
Sorry.
can you get it to
Having
advance?
trouble. There we go.
There we go. Nope, one before that. There we go. All right. So I want to talk a little bit about childcare and its economic and workforce connections, which I think intuitively we all know. Helping working parents is critical. Childcare is very expensive, and so the subsidies that we provide to qualifying low-income families allow these people to work and thus support the economy. That's probably what most people think of when they think about the child care subsidy program. But the second bullet, one of the other things that this federal block grant does is carve out money specifically to improve the quality of childcare. And we do that in direct assistance to childcare businesses and childcare workers. Federal law says that about 12% of the block grant has to be carved out for quality improvement. And so we push money down to the local level as well for these types of investments. This can include anything from professional development to business training, purchasing curriculum for these childcare programs, but all different types of activities to really help improve the quality of care. And then, of course, the third bullet is, what are we doing to help build tomorrow's workforce? So all of these kids that are in childcare right now are going to be our future workforce, 20 years from now. And that's why it's so important to really think about quality childcare, so that as those kids are being served in these childcare programs, we're doing everything we can to help them prepare to enter school and to be kindergarten ready. So there really are multiple aspects that really help address both the economy today and the economy tomorrow. Okay, next slide. All right, Laura, there we go. So I want to talk a little bit about the local boards and some of the ways that they engage in the administration of childcare. So as you know, there are required membership categories at all of the WIBs. Our state law, we actually operate under we owe a grandfather for some of our board structure. And our state law was recently amended to require that each of our 28 boards have at least one board member with childcare expertise. So that could be somebody that actually is a childcare program director. We've had some people from Head Start programs. Some of our boards have more than one individual with childcare expertise, but it's really that idea that at a board member level, you are getting that kind of insight from a childcare program as you're looking at all of those things that boards look at, which in Texas is not only the WIOA types of information, but obviously includes childcare in Texas. We also have required local committees so that we're getting input from stakeholders. Our boards are administering, I mentioned quality improvement. Each year, they're administering over $75 million at the local level to help improve the quality of childcare. And as they're designing and delivering those services, you really want to talk to the people that you're trying to help. So talking to those childcare program directors and staff to really understand what are the issues that we need to address. Workforce issues are always at the top of the list. One of the challenges that childcare faces is that the childcare workforce is not a high-paid occupation, as most of you probably know. And so thinking about how you invest to make sure that the staff that you have are trained and qualified, but that you're also thinking about career pathways for them as they grow in their careers. I'm excited to hear Tracey speak in a few minutes about registered apprenticeship, because that's something that we in Texas have also invested our CCDF money in, actually building childcare registered apprenticeship programs to help support the childcare workforce and their growth. I think that was a great opportunity for a workforce system that's used to working with registered apprenticeship programs. So those types of career pathways are always critical to think about. And then, of course, the Child Care Services Program, the big chunk of money that supports in Texas, over 150,000 children on average per day are getting financial assistance so that their parents can work or can attend training. In Texas, we allow unemployed parents to enter the child care program. Not a lot of states do, but we saw that during COVID, when clearly everybody virtually was not working for a period of time, you needed to have an initial job search period as part of your child care eligibility. So we provide parents up to 3 months to look for a job, and they can retain their child care subsidy if they found employment within 3 months. And then, of course, as I mentioned, our quality improvement activities that are such a critical part of helping ensure that the child care programs that our kids are attending are high quality. I think what's great about quality improvement, we have about 150,000 kids in care each day. But our license capacity in the state of Texas is about 2 million. So clearly we're a small piece of the puzzle as far as the number of kids that are being served. Private pay parents are funding the vast majority of childcare. But when we invest to improve the quality of a childcare program, all of those kids are benefiting. So it's an investment that impacts not only the 150,000 children that we're serving, but every other child that's enrolled in that program gets the benefit of higher quality childcare to help with their developmental growth, their social emotional growth, and really making sure that they're kindergarten ready. Okay, next slide. So there has been a lot of talk lately about childcare. And there have been a lot of employer-focused groups that have really sort of taken up the mantle of childcare being such a critical support. The U.S. Chamber of Commerce Foundation issued a report that talked about childcare that got a lot of people in the workforce arena thinking about childcare. And we're starting to see this trickle down now state to state. And so I'm really glad that all of you are on the call today because your engagement in this issue is really important. When employers say something is needed, I think there's a lot of focus that tends to get put on that because clearly employers need workers who are going to be reliable, who can come to work every day. And if you don't have childcare, stable childcare, that's going to be an issue for your workforce. Here in Texas, we just recently had a group of employers come together through this Employers for Childcare Task Force that was a conglomeration of the Texas Restaurant Association, a public policy entity, and then an early childhood entity. And they held regional meetings all across the state. And these were meetings for employers. It was a really deliberate attempt on their part to engage with the employer community to make sure that employers understand what this issue is and how they can get involved in supporting this. Next slide, please. We're also trying to think about what can we do to support employers in this arena. So not just through the subsidies that we provide, but we've had a lot of employers that have approached us and said, we know childcare is a problem. We want to figure out how to address the childcare needs of our employees, but we don't even know where to start. So we issued a procurement and we are going to be selecting technical assistance entities who employers can call and say, hey, I want you to come help me. And we're going to pay for that technical assistance for employers. So it's another mechanism where we're trying to merge childcare with employer needs to try to address obviously the critical need that they have in making sure that there's childcare available for their workforce. And then interestingly, and not just because Lori is from Dallas, but interestingly, Dallas County also just approved a local program, and it's a subsidy program that's a matching program. Employers put in cash, and the county is using some of their money to match that in an effort to help reduce the cost of care for their employees. This employer match model is really gaining traction in a lot of states. It's a model that we're seeing being tested in a lot of areas. And Dallas County is putting some of their local county money into that. If you look at the next slide, Lori, I wanted to highlight some other states that are doing similar types of things because this is certainly not limited to Texas, where a workforce agency is operating childcare. You're seeing this kind of employer childcare engagement all across the nation. So Colorado, similar to the technical assistance program that we're about to launch, also has an EPIC program that works with childcare businesses to expand the availability of childcare. Michigan has done a lot of work building roadmaps for different constituencies. They also established a state-level employer matching subsidy program. So similar to that Dallas County pilot, this is one at the state level where the state is investing their general fund to match employer contributions. Indiana did something similar to that, but they have a menu of options that employers can pick from, CCDF funded, to help them meet their employees' childcare needs. And then Kentucky and North Dakota also put together an employer contribution program using some state general funds. So I just want to highlight that there really is a lot of activity all across the nation with childcare agencies who are trying to get more engaged and recognize the need to really connect with businesses as we think about how we expand childcare and support the economy and those workforce connections. So I will stop there and turn it over to Tracey.
Thank you so much, Reagan. I appreciate this opportunity to talk a little bit about the work that Midwest Urban Strategies and the Early Childhood Workforce Connector have been doing together to advance registered apprenticeship as a strategy to support the workforce in early childhood education. The Early Childhood Workforce Connector is made up of a partnership of a number of organizations, and we were funded 2 years ago by the Department of Labor to stand up this intermediary model to do that registered apprenticeship work. And we're glad to be in partnership with organizations like the Council for Professional Recognition and the Kentucky Governor's Office of Early Childhood to continue to do this work. Next slide, Lori. So at the base of our work is the focus on connecting the dots. So we take a systems approach to advancing registered apprenticeship. And when we move into states, and later in this conversation, I'll share a map of the United States, and it indicates the places where we have ongoing partnerships. In each one of those instances, we begin with those state level agencies in order to make sure that the work that we do on the ground is in good alignment with the work that's happening at the state level and the way that the system has been designed to support local areas. The most important of those is the work that happens between the local workforce development system and those childcare providers and employers. So I will tell you that I have heard again and again that one of the key barriers to engaging around this issue of childcare from the public workforce system has been the question of wages. And Lori mentioned it, and Reagan mentioned it, and you'll probably hear it again and again, and you've probably said it yourself, that the wages are low, so it makes it difficult to really engage in investments in that space. But I think that COVID taught us that investing in childcare is inherently in all of our best interests. And so I think, Reagan, I appreciate that you shared the reality that it isn't just about the childcare workforce, but the work that that workforce does with our youngest minds. Those brains between 0 and 3, 75% of the brain development happens during that time frame. And so it really does require a prepared and skilled worker who's in those classrooms, leading those classrooms and teaching those young minds. So next slide, Lori. There was a paper that was put out prior to COVID, and then it was updated post-COVID, that really looked at the impact of not having access to quality childcare had on local economies. And it's significant. So we lose $122 billion, according to this paper, when there is not adequate access to quality childcare. And that impact affects not just working parents, but also the communities in which they live and work. So making that investment is one that is worth it from the public workforce system side and the ecosystem that is a part of our network. This is a problem that has been around for a very long time in terms of the underfunding of the public work of the childcare system. And it has resulted in insufficient supply of childcare slots in communities. The important thing to remember, and we'll probably hear more about this as we move along, but those classrooms are required to have a certain number of teachers in relation to the number of kids that are being served. So when we look at the infant to toddler ratio here in Wisconsin, for infants under the age of 2, it requires 1 teacher in that classroom. And so if we don't have enough talent in the classroom, the um, the um, there's an impact on our ability to open classroom doors. So at the end of the day, access to early childhood education is an economic imperative. Next slide, Lori. In order for us to, as I was saying, really meet the needs of those of our communities, we need to make sure that there is adequate teachers prepared to do work in the classroom so that we have open classrooms. That work is really bolstered by bringing registered apprenticeship in as a strategy to develop the skill and the talent in the early childhood education industry and help individuals grow. Next slide, please. We have worked across the country over the last 2 years to build out this model that really does include all of the various sectors that impact the expansion of registered apprenticeship in early childhood education, from state agencies, universities, and community colleges, those early childhood employers themselves, as well as CBOs and workforce development boards. They've all been important players in helping us to build out this model, and we've achieved a good amount of success thus far. Next slide, Marie. As you see here, we have developed partnerships in almost all 50 states, and those partnerships include relationships between local employers and sponsors, as well as the related technical instruction providers. All of that work has been done to build those partnerships, building up those and establishing those registered apprenticeship programs from the development of the standards and appendices, as well as registering the programs and then getting them stood up and operationalized. And we've done that work over the course of the last 2 years. Next slide, Lori. It's important to think about the impacts in local communities and that registered apprenticeship can play when it comes to building up the talent pipeline. So one of the challenges that industry faces, as we're all aware, is the impact that low wages have on their lives. So registered apprenticeship as a strategy is helpful because it does provide the opportunity for those increases in wages as an individual is moving through their registered apprenticeship program. That alignment to the state's quality rating system is another important thing to consider. As a workforce board, you have the opportunity to support a registered apprenticeship program that has the opportunity to bring increased revenue into that center. And for most centers, when they see that increase in revenue, it's a way for them to give back to their employees by continuing to increase those wages. As an earn while you learn strategy, registered apprenticeship gives those apprentices the opportunity to advance their education. Many of the programs that we facilitate are in fact stacked apprenticeship programs. So it begins with the child development associate and moves its way up. And we'll talk more about that in a moment. And that gives us the opportunity to really support the career advancement of the early childhood education industry. Next slide, please. And here we are. So the opportunities for growth in the early childhood education space are significant. And we use the idea of the Child Development Associate as the building block credential. It's really sort of that entry-level credential that individuals can obtain. And many of the apprenticeship programs that have been built have used that as the basis and then moved into an articulated program that moves into an associate's degree and a bachelor's degree. We don't have a master's degree yet as part of an apprenticeship program, but certainly that's on the horizon for us. So next slide, Lori. Workforce boards are actively engaged in a variety of ways in the work that we're doing, and you can play a role in that too. It is really important that we have the public workforce system at our side as we're working to build out these support systems for the early childhood education industry. And these are a variety of ways that you can accomplish that. One of the things that I heard from folks and have heard for quite some time is a concern about the impact that this might play in terms of the WIOA performance measures that we all are concerned about. And, it is our experience that given, credential attainment, measurable skills gains, employment, retention second and fourth quarter, all of those are easy to obtain with registered apprenticeship. In fact, they're built in. Next slide, Lori. So the ways in which you as a workforce board could play a role in registered apprenticeship in the early childhood education space includes acting as a program sponsor. We have boards that are acting in that capacity, helping to facilitate the coordination and administration of that apprenticeship program for their local area. You could also support by referring individuals into the registered apprenticeship program who are coming in as part of your system. You could provide some on-the-job training and support through the through your local ETPL or your state's ETPL for the related technical instruction. Next slide, Lori. And this will be, I think, posted up on the website, but we had a cute little video here from an apprentice that talked about her experience and her why. And so I encourage you to check that out. But as of the date on this data was March 31st. I just was in a meeting today and learned that we're at over 1,000 apprentices that we have been able to support in their journey just over the course of this last year. And that's a pretty significant number when you think about how condensed this industry is and the small number of apprentices that are developed in each local program. Next slide, please. Awesome. On to Madeline.
Thanks, Tracey. That was so exciting to hear about the work that you're doing. I think the project that I'm going to talk about is a little more dry because it has to do with the research project that we did with NAWB, but hopefully it gives you all some good information to kind of back up this idea about workforce boards getting more and more involved in the childcare pipeline. It goes back a number of years that NAWB has been working on a 2-gen approach on family-centered employment. They've worked with another organization, Innovate and Educate, whose work is behind this survey as well. And what they found is that as they talked with different workforce boards, that there really was a lack of data around what do workforce boards collect and having to do with family-centered employment. And so this small project was developed with support from the Annie Casey Foundation to really do a survey and look a little bit deeper about how workforce boards collect data and use parent data. So in the fall of 2024, NAWB sent a survey out to 522 workforce boards, and we got a response rate of 17%. So we got 87 responses back, and 57 of those were complete. We used all the responses that we received to generate the findings that I'm going to share with you. Also, the report and the survey that we used is an attachment on the report, can be found on NAWB's website. So going on to the next slide, we just to share some of the key findings with you. The survey responses collect data on parental status. What we found is that that there's a real focus on eligibility for WIOA programs, and yet 60% don't clearly define parent. And as we know, there's a lot of different status categories that people could fall into who are raising children, whether they're grandparents or biological parents, foster parents. So it was really interesting that there was not, for a majority, a clear definition of parent. The driving force of collecting data was to inform or update WIOA plans for 70% of our respondents, and 88% partner with parent-serving organizations, but only 59% formally reflect those partnerships in their plans. So what we found is that there's while there's been a growth of partnerships, they aren't all reflected in their plans. And we also found that most workforce development boards want to collect data, and childcare needs and benefit eligibility were high on that list. So that's an overview of the findings, and really moving on to the next slide, I'll go into a little bit more about what do workforce boards collect information on. And I won't read all of these, but what we found is that there's more data collected on young parents. And again, this is driven through the WIOA requirements, and that really it's those requirements that drive the data collection. And it makes sense that workforce boards are collecting the data that they're required to report by their state and federal WIOA agencies. So going on to the next slide, there was, I think, another slide in there. No, yeah, just that in addition, there is additional information collected on childcare needs that people reported, but it wasn't a significant amount in terms of the responses that we got. But it was mentioned. So now going on to the next slide, we'll look at what kind of activities are workforce boards engaging in to support clients who are parents. And what you see here in the light pink is workforce boards reporting that they do perform this function, and then what percent is included in include this in their WIOA plan. So there's a lot more provision of family-centered services than would just be apparent from a review of the plans. And we thought that was an important thing to highlight. And you can see that the most common is partnerships with organizations that serve parents, and providing intensive supports to reduce employment barriers for parents, which again, as we know, connects to childcare, right? Because if families don't have the childcare they need, they can't go to work. So those were the biggest, the biggest reported areas of activities, and also again focusing on teens, which has to do with the WIOA requirements for youth. So moving on to the next slide, these were the kinds of additional data that workforce boards were hoping to collect in the future, And really the childcare needs and eligibility were really at the top of the list for what workforce boards were turning to, wanting to have more information. And then you can see the other responses, less prevalent. So I think we definitely saw that childcare is an emerging interest. And what we really thought a next step would be coming out of this survey would be, a further exploration about these key findings. And we really think that looking at this definition of parent could be really important for identifying the specific needs of different caregivers, whether they be, birth parents or adoptive parents or foster parents. And another interesting area that we thought could really do with more research would be looking at challenges and solutions for workforce boards to collect data and use the family-centered employment data to improve their services and to, for instance, develop data sharing agreements to inform parental data collection efforts so that workforce development boards could take advantage of partners' existing data collection. So we all know that there's a lot of organizations in the community that are collecting information. And so the idea would be to look at how can we leverage the data that's already being collected on our population that we're serving in the workforce board to reduce the burden on parents of data collection. So those were just a few areas that we identified for future, research efforts. And I think that it's really been so interesting to hear about both of these presentations because I can imagine that both of these efforts are improving data collection in their regions where these projects are happening in Texas and then in all the states that are involved in the childcare apprenticeship programs. So it's exciting to see the synergy coming together for more data collection. I think this is my last slide, and we have time for questions and from the audience. I think all the speakers can probably join me here and people can put questions into the chat or feel free to unmute yourself and ask a question. I think Lori may even have a question to kick things off. I'll turn it back.
Thank you, Madeline. That's
Sure.
Wonderful. Appreciate everyone's attention. Apologies for my handling of slides. I was doing better, but
You did great. You
doing
did
its
great,
thing over
Lori.
here. Y'all did a great job despite that. And yes, we do have time for questions. Seeing we haven't had many questions during the presentation because I think there was so much detail, so much energy behind this. I kind of want to go back to what we're dealing with here is workforce boards. Lucky if you're in Texas and you actually are fully integrated for 2 decades in childcare delivery and the childcare struggle. Doesn't mean we've solved it, but it does mean we've been aware. I think I want to know more about how every state operates this same system. I'll start with Reagan. Every board, I think, in the US needs to find their state delivery system. That first chart that we looked at, understand how your state works. But Reagan, despite not having legislation, there's ways they can connect, correct? There's nothing limiting it from adding childcare to your American Job Center, right?
Yeah. So, absolutely. And it's interesting, states are pretty unique in how they administer their subsidy program, which I think is what most of you would likely think of if you wanted to partner. I have people who need childcare in order to work. It would be great if they could get a subsidy, sometimes called a financial assistance or a scholarship. It would be great if they could get some help paying for childcare. In Texas, we don't lower the income threshold for families. We set it at the federal maximum, but that means we also have a waiting list. Some states, they actually lower the income threshold to focus on lower income families, and they try not to have a waiting list. So I think the first thing you really need to understand is who's operating this and what's their eligibility criteria for receiving childcare, since it really can look different in each and every state. Some states have state operated eligibility. Some states have county operated eligibility. So it really can look different structurally about who you would need to partner with for those kinds of eligibility determinations. And then, of course, every state is investing funding in the childcare workforce to really help grow the childcare workforce. And I think that there are still a lot of opportunities to think about career pathways for childcare workers. Tracey said lots of people are concerned about investing your WIOA money because the wages are so low. And I totally understand that. But you also have a lot of states that invest their CCDF money in professional development and in training. And so thinking about what a career pathway looks like for these individuals, I think is another area that's, an opportunity for discussions. I know that Michigan was working really closely between their childcare agency and their workforce agency at the childcare workforce. So again, I think there is some of this happening across the nation. It's just a matter of making those connections.
Thank you so much. Trace, go ahead.
Yeah, I just want to piggyback on what Reagan said. And Madeline, you put something in the chat here, which I think is important. So every state has a child care resource and referral system that is, federally funded, and those states then pass those dollars through to a local agency that facilitates support to those businesses and organizations that are delivering childcare services. That's important for us as workforce boards, because that is a place to go where a number of childcare entities are members of those or participating in those organizations. So it's a great way to sort of organize locally and somewhat organically is through those childcare resource and referral organizations. And again, different for each state. So if you just Google childcare resource and referral in your state, you'll find a link to that. And I think the other thing that is important to note regarding the robust sort of expression of interest around this issue, there are states that have developed really interesting approaches and have looked at other states and begun to replicate. So again, Reagan, you mentioned the work that Michigan has done to bring employers in as partners in investing in childcare. Other states have replicated that and made that their own. So it's important to understand sort of that broader ecosystem that is emerging to support that industry, which is so critical to the success of the rest of ours. So I just wanted to add that.
Madeline?
Yeah, the childcare resource and referral system is such an important and probably underfunded, just I'll throw that out there, part of the childcare landscape. And I also would just put a plug for one of the loves of my career lives is Head Start and early Head Start programs in your community. These are for low income families. And so they're parents that are generally needing education and support. And the part of the Head Start program is to provide training and support so that those parents can move on to become financially independent. And so they're a great, and probably they need your support of the workforce board and of the community to really wrap their arms around those families and help them plug into education and training and become active workforce participants. So they're a great resource.
Thank you. But yeah, I think what I'd like, I don't think we have any questions yet. I appreciate the audience. You guys are great out there, but if you'd like to come on camera or just pose a question in the chat. But I don't want to lose sight. We have this fabulous panel gathered for you, and I'm going to ask them to do some closing remarks here. Where do we go from here as workforce boards? What's the next big challenge in your opinion? Families must work. That's, sorry, didn't mean to go there. Families must work, and I'm afraid that we are not solving the problem. We're mitigating it, but we're not solving the problem. Is it a source of public money? Does public money have to enter in? I know Reagan can speak a little bit to what Texas has done by really bringing a lower age into public ed. We're doing 4-year-olds in kindergarten, some cases 3-year-olds. We're really reaching at this point, but without public subsidy in a much greater response. I think you're seeing young adults, two family incomes. They'll tell you that childcare is as much as their house note. Their mortgage. This is ridiculous. I guess it always could have been. I see a lot of people my generation raising grandkids because, or at least keeping the kids so that mom and dad can keep their careers on track. I don't think there's one answer for everyone, but I do think we have to make some public policy corrections. And employers, this is almost like a benefit in healthcare. They've just assumed that this is another benefit that they have to add. And of course, you have the whole other group that wants their, can you help me pay for my puppy care during the day if you're paying for someone's children? I don't even want to get into the HR implications of when you offer one benefit, everybody wants that benefit. I'll start with Reagan, but Reagan, where do we go from here in correcting how far off we have gone? Because healthcare is another problem, but childcare is keeping people out of the market. Our workforce participation rate in most states is in the 50s, 60s. We're getting Congress saying more people have to go to work. Where does this magic occur, if at all?
I mean, it's the question that just doesn't have an easy answer. It really doesn't. Childcare workers aren't paid enough, and parents are paying too much for childcare. I mean, you just have a really challenging ecosystem that you're managing. Interestingly, yesterday, I had the opportunity to meet with the new Deputy Assistant Secretary of Early Childhood for the new administration. And they really wanted to understand childcare and workforce connections. And it's this whole idea that childcare is critical to a thriving economy. And they pointed out that in the Trump administration's first term, they doubled funding for CCDF. And that's not to say that Biden didn't also invest in childcare, which is why I say it's been a bipartisan issue. We truly have seen the childcare block grant double. And even with that, it's still not enough. And I think, people plan for years to invest in their child's post-secondary education, college, whatever it is. And they plan that for years, for over a decade. And infant childcare can cost just as much, if not more, than a year in college. And parents struggle because it is so expensive. You'll hear a lot of people on the early childhood side say, I wish that we looked at childcare as a public good, as a public need. Just like we invest in the K through 12 system, can we invest in early childhood? I think you see some states investing in pre-K. You'll hear a lot of childcare programs express a little bit of concern with money being infused into the education system and not into the childcare system, only because infant childcare is much more expensive than childcare for 4- and 5-year-olds. It is much more expensive because you have, one teacher for 4 infants as opposed to one teacher for 20 4-year-olds, whatever your ratios are locally. If the school starts serving more 3- and 4-year-olds, and you leave a childcare ecosystem serving infants and toddlers, the care gets exponentially more expensive. And so it's having to think through, when you're making investments like this, how do you make them in a way that lifts everyone up, which is why it's such a complicated discussion. I can't say Congress appropriate more money. That's not my job as a state employee. I certainly recognize the increased investments that they've made have helped us in our ability to serve more children and families.
Appreciate that. Who wants to go next? Burning need here. Madeline, Tracey?
Yeah, I'll hop in. I mean, I think that at the end of the day, uh, we are nowhere near universal childcare access, and so it really does require all hands on deck and all skin in the game. We need our employers to be engaged. We need the ecosystem in childcare to be engaged. Of course, they already are, and we need to, as a public workforce system, I think, understand our role as advocates and allies with the early childhood education industry, and how we can, mutually support each other, because we have a lot of shared interest in advancing some policies that can support both of our works.
Thank you. And I know you touched on the fact that boards don't have enough money to do their own support services. This has been a godsend to the Texas system, because the cost, the people we're finding to go to childcare while they're in training, while they're work, it's been an amazing change for the support service money. And if there are new parameters to what can be spent in support by federal legislation, I think getting the relationship attached to childcare system is critical. Madeline, we're going to give you the closing remarks before I thank everyone.
I'll just say quickly that I do think policies that look broadly at giving subsidies, supports to new families, to new parents across the board in this country are very appropriate. We're talking about child tax credit and policies that are desperately needed for young families of young children, and often these are younger parents, to have the resources they need to take care of their kids and to work.
We need innovation, don't we? And we all need to stretch our brains a bit. Upcoming events I'd like to share real quick with the audience. NAWB invites you to any of our events that are scheduled. There will be additional childcare webinars. Those are pending right now, but we're trying to get them scheduled for July and August to complete the summer series. And I personally have to thank these lovely, lovely people who joined us today. You guys you did what I asked. You knocked it out of the park. Thank you to the audience. You guys stayed with us. We were small but mighty, and each one of you did. I think you were engaged, and I appreciate that. That's the whole point of these webinars. Let's hope that we see some policy changes on the horizon, and we'd love to hear from you as workforce boards. If you want to hear more on childcare, please let NAWB know. Let us know that this is something that you really could use in your work. Ladies, thank you again so much from me and from the leadership at NAWB. We appreciate you being here today. Thank you all for being.
Thanks, Lori.
Thank you,
Thanks,
Lori. Great job.
Thanks. You too.